Dr. Max is here. We have a patient today who is 65 years old male with previous hair restoration procedures. And I've been frequently asked how many times patient can have hair restoration surgery. And the answer is no, really limit. It all depends what we have donor hair available and what the wishes of the patient and what the extent of the hair loss. Occasionally we have to do 2 or 3 procedures to achieve the goals that were set by the patient. And it's definitely one of those cases today. Patient had really good results from previous 2 FEE procedures, and today our goal is to reshape the hairline slightly and then add more density in the frontal area. And if I'm able to get more grafts, then I will work on the crown area as well, as we have a little bit of noticeable thinning there. I think by that time, this is the 3rd procedure, it should be last procedure, especially when patient is compliant with the preventative therapy and there is no more progression or noticeable progression over time. Again, I want to emphasize that preventative therapy is absolutely essential, especially in settings of hair restoration surgery, as we want to minimize thinning, move into the new areas. Dr. Max, follow. I got about 1,000 grafts now, and aim today to get 2,500, maybe 3,000.
Grafts look good, and we're above the 2,500. I'm still counting.
So I just finished harvesting. I estimate I got at least 3,000 grafts. We are in the final phases of collecting. So the way it works, I do all the dissection with my own hands, and then I have an assistant, and she collects them as we go. I do get immediate feedback of how the dissection is going. My goal is to minimize the transection rate to a small percentage, between 1 to 2, maybe 3%. It's a little bit more challenging with patient like one today because he had 2 previous procedures. Every procedure creates scar tissue. Scar tissue can lead to deviation of these angles of the exiting angle of the hair follicle. So it does require a lot of patience, a lot of intricate movements, very precise movements, and definitely having this high precision wall-mounted microscope does help me direct my punch precisely and minimize the transection rate. So again, we got over 3,000 grafts. I think this is what we actually need to get the rest of the thinning areas addressed. Patient is very compliant with medication, so I don't foresee any need for any future procedures. So we'll head into into the implantation phase. Everyone will have a lunch now, and we'll finish this case. Today's Friday, so we're trying to finish it before 4 p.m. Follow, ask questions, subscribe. Again, I'm always monitoring the social media, and I will try to respond to most of the questions. Was Dr. Max.